This conference will now be recorded.
Okay, good morning, one and all. Am I audible to all of you?
Yes, sir.
Okay, today we will be discussing a small topic in lids, that is blepharitis. Blepharitis is nothing but an inflammation of eyelid margin. Now, if you can see this is the lid margin. Okay, this is the posterior margin. This is the anterior margin. Both posterior and anterior margin are divided into exactly equal halves by a small muscle called muscle of Riolan, which is present in the center. Just above that, there is a gray line. So if you just see the lid margin, you will see a small gray line, faint gray line extending lid margin. That exactly divides the lid margin into two halves, anterior half and posterior half. So anterior half, there is these eyelashes which open up from the skin along the anterior margin. In the posterior margin or posterior half, this is the posterior margin, and you have the opening of meibomian glands there. So if you just examine your lids, you will see openings in the posterior margin, a central gray line, and then a eyelashes in front of the gray line, and then anterior lid margin. So this is the applied anatomy of eyelid margin. So now these margins are very sharp. The posterior margin is extremely sharp, and it is called as mucocutaneous junction because the conjunctiva ends there exactly at the posterior margin. Anteriorly, the skin ends here. Okay, so here just if you continue along the posterior margin, there is conjunctiva. If you continue along the anterior margin, the skin, and remaining the layers of the skin are as usual, which has been discussed in the previous class. I will not go into those details now. As of now, I hope the anatomy of eyelid margin, especially this particular area, is clear. Now, when there is an infection or inflammation of this particular area only, it is called as blepharitis. There are some small glands within around these meibomian glands and around these eyelashes roots, like glands of Zeiss and glands of Moll. Whenever these are also infected, the patient develops some conditions like stye, or you call them as internal hordeolum or external hordeolum, which will be dealt in the next class. Today we will just be talking specifically about the eyelid margin infections. So I hope the basic anatomy is clear. This is the anterior margin. This is the central line called the gray line, and this is the posterior margin. Between the gray line and the posterior margin is the opening of the meibomian glands. Between the gray line and the anterior margin is the openings of the eyelashes, or eyelashes come out from there. So when there is an inflammation, chronic inflammation of the eyelid margin, you call it as blepharitis. So now blepharitis can be anterior, posterior, or involving both anterior and posterior. So there are different etiologies for anterior blepharitis, different etiologies for posterior blepharitis. When margins only are involved, then you call it as marginal blepharitis. Now, if you see here, this is an example of anterior blepharitis. There are two basic types of anterior blepharitis. One is staphylococcal and one is seborrheic blepharitis. Staphylococcal blepharitis is nothing but it has scales on the lid margin. You can see the anterior lid margin is involved. The posterior lid margin is free. It is not involved. And this is you can see the small openings of the meibomian glands. Okay, so then you can see these are the small openings of the meibomian glands along that line. This is the canalicus punctum, or open, and from where the canaliculi continue. These are the eyelashes which are present along the anterior lid margin. I can see some hard scales, ulcerative lesions here. You can see some small ulcers here. So, and there is a hard scales which are stuck to the anterior lid margin, and when you try to pull them out, they bleed. So it is Bleeding means it is not very heavy bleeding, just mild bleeding. And this example is called as staphylococcal blepharitis. There is another example called seborrheic blepharitis. It is very greasy. Here it is hard and scaly, and here it is very greasy. There is matting of eyelashes. The eyelashes are stuck to each other, and there are soft scales. The scales are soft, and they are squamous in nature. Here it is ulcerative, and here it is squamous in nature, and usually along the anterior lid margin. So basic two types we have: staphylococcal and seborrheic. Seborrheic is greasy, means it is greasy, and this is hard and ulcerative. So what can this blepharitis cause? So why should you treat blepharitis? If you observe in the previous picture, this is the eyelid margin. Okay, this is the anterior margin, and if you see here, this margin is eyelid margin is very close to the cornea. So what are the problems it can cause? Since it is caused by since the inflammation, you can see some new vessels growing over the cornea, and the inferior part of the cornea becoming slightly hazier. So this is called as marginal keratitis because it is caused by margin of the eyelid. And there is inflammation of the cornea. They constantly rub on the cornea, they ulcerate the cornea, then the cornea heals, and over a period of time, this recurrent process goes on to form opacity on the cornea close to the lid margin. It is usually at the 6 o'clock position of the cornea. You see this type of keratitis. So when this can also lead to tear film instability, some conjunctivitis, and recurrent styes. Styes are nothing but infection of the glands of Zeiss, which are present in the root of the eyelashes or close to the root of the eyelashes. So it can give rise to infection of the eyelashes. Those are called as styes, and it can give rise to conjunctivitis, marginal keratitis, and tear film instability. So these are the complications. How do you treat it? Treating anterior blepharitis is difficult because you can only control it, you cannot cure it completely. It's basically hygiene which you have to follow, and you have to prescribe antibiotic ointment, weak topical steroids, and tear substitutes. So it's a treatment is not curative, it is just what you call to control the symptoms. You can just suppress it, and lid hygiene, maintaining of lid hygiene is priority. Now coming to posterior blepharitis, it is called as, there are basically two types. One is meibomian seborrhea, and second one is meibominitis. Meibomian seborrhea is nothing but, you can see discharge or oil globules along the posterior margin. It is like a fluffy oil accumulation, oily accumulation, which is like a foam. It is you can see a foam along the posterior lid margin, and this is because of excessive oil secretion from the meibomian glands. And when you press the lid, you can see more amount of foam coming, and it is because that meibomian gland main function is to secrete oily layer of the tear film. So more of oily secretion gives rise to this foamy appearance along the lid margin. So this is meibomian seborrhea. And when there is an inflammation of the posterior margin along with meibomian orifices, they get obstructed, they get blocked because of discharge. That is called as meibominitis, and when they, over a period of time, it can lead to scarring. This scarring will again in turn lead to problems in the cornea, inferior margin of the cornea, and it can lead to marginal keratitis, recurrent chalazions, papillary conjunctivitis, and tear film instability. So it is a simple, straightforward topic. You have to first understand what is anatomy of lid margin, what is anterior margin, what is a posterior margin, what is anterior blepharitis, what are the causes, and what is the posterior blepharitis, what are the causes, and what are the complications, and how do you treat it. So treatment is again same, because here oily layer is involved. Here you involve systemic tetracycline if it is chronic, and you give a course of systemic tetracycline over a period of 1 month, and warm compressions, lid hygiene with weak shampoo, and weak topical steroids, and tear substitutes. So treatment is just symptomatic treatment, and treating this lid margin infections takes a top priority before taking up patient for cataract surgery, because these can be the source of infection post-operatively, like conditions like post-operative endophthalmitis. So examining lid margin is a very important thing you have to do when you are doing a proper eye examination. Most of the time, people tend to skip it. It should not be done like that, because you have to start examining from lid and conjunctiva and so on, step by step. Because if you directly examine the cornea or the lens and without giving importance to lid, you might miss some important findings which could lead to complications later. So this is posterior blepharitis. Treatment is very simple. You have to keep lid hygiene. How do you advise the patient? You say the patient that you a shampoo, put a drop of shampoo in 3 spoons of water, dip a cotton bud in that, and clean your eyelashes. Just like how you rinse your hair with shampoo, similarly you have to tell them to clean their eyelashes with weak shampoo. There is nothing called weak shampoo which is available in the market. You have to dilute the shampoo which is available in the market. So what is infection of eyelid margin? So when the infection is internal, it is called as internal hordeolum. When the infection is external, it is called as external hordeolum. Now, what is happening here? Here there is a gland, the meibomian gland, which is present in the posteriorly. When that gets infected, as we had seen in the anatomy, the meibomian gland is present behind the gray line. When it gets inflamed, you call it as internal hordeolum. And when the eyelashes, the glands along the eyelashes, like glands of Zeiss or mole, get involved, then you call it as external hordeolum. Usually in such patients, you have to rule out diabetes or some systemic infections which can cause such symptoms, or you have to advise a good hygiene for the patient. Apart from that, the last but not the least, we have something called as parasitic blepharitis. These are louses. When louses are present along the eyelashes, you call them as parasitic blepharitis. And the causes for that are pityriasis, palpebrum, and pediculosis. When these louses are present, they give rise to a lot of irritation along the eyelid margins. The lid margins are red and inflamed, and these you see these lice anchoring along the eyelashes. Treatment is you have to remove each of them mechanically, or you have to epilate the eyelashes. Sometimes drops like pilocarpine are used so that they fall off on their own, but most of the time you have to mechanically remove each parasite which is present there along the eyelashes. So this is about today's class about blepharitis. Nothing much. So that is about like here. It is a straightforward topic. What is lid margin? What is anterior blepharitis? What is how do you treat them? That's it. Okay. Thank you.
Thank you, sir.
Thank you, sir.
Yeah.
This conference will now be recorded.